Good afternoon, everyone. I think we'll talk today for telemedicine evolution, technology, and limitations. And mostly, I will describe our experience. Mostly worked in India only. Okay. And why do you need really telemedicine in our country? Because everybody thinks that their work should be whatever information comes, it should be quick and it should be responsive information so that but in our country, why should we get telemedicine? This telemedicine is important because we have shortage of medical specialists as well as the primary care physicians with a low doctor to patient ratio. It is 1:1953 by the NMC against a recommended of 1:1000 as per the World Health Organization. There is shortage of medical doctors, so no access to current informations, and also the web content, the resource content for medical education from time to time. That's the major reason for which the lack of really doctors and skilled paramedical staffs and skilled doctor like for super specialist and all. That's why we need a telemedicine in our country. Hopefully in the another 1 decade, probably this will be breezed, but still you require telemedicine. You see, many people must be thinking that whether really will require telemedicine or not, even if the doctors are available now, if this ratio is breached as per WHO, it will be required. You must have the best experience, I think, with the COVID, though it was a bad experience, but definitely this is a good experience in terms of how you embrace the technology for the healthcare. I think the most important thing is a human being always wants the care at their doorstep. Everybody wants a treatment at home. Don't you feel so? That at a home, suddenly if you have loose motion, fever or something, then you like to just bring a phone to your relatives and this our country. But that doesn't happen in the developed countries. Mostly you need to consult a physician. So that's the benefit of telemedicine home or from your workplace or any time you can think of, you can call with a telephone. So the telemedicine starts with even the telephone only. And our mobile penetration in the country is quite large now. It's very high. I will show you a slide. So hopefully this will improve the healthcare of the unreached rural communities, which are really not populated by the physicians. There is a huge gap between demand and supply infrastructure. So coming to the telemedicine, so this is mostly what you can do is you can do from a nodal hospital with your bandwidth network with ISDN line or a lease line you take from any kind of BSNL, Airtel and all. Also with the VSAT, which is supplied by, the terrestrial network. So these are the basically terrestrial network and this is the space VSAT. This is mostly, it was done by ISRO, and the patient under treatment and the physician treating the patients, a remote telemedicine console having audio, visual and data conferencing facilities. With all these, you can basically do the consultation from the doctor to the patients. Either you might be a primary care doctor or a super specialist or an expert doctor or a specialized in medicine, obstetric gynecology, pediatricians like that. A central medicine server having audio, visual and data conferencing facility, and mostly it is done from a nodal hospital to referral hospital. This is the standard way the telemedicine was done and began 20 years back. And subsequently, you can see that what is really telemedicine? Either you do the use cases, you can see this slide. This can be done for professional consultations, like for the care of the healthcare of the patients through video conference. And the diagnosis and treatment also can be done with the asynchronous store and forward facilities, like you keep your x-rays, the prescription, the findings, everything, and you can transfer after storing them, after scanning, then store them, then forward them to the other end from your end. Suppose somebody is a nurse practitioner or a counselor, you want to pass some information like somebody is doing genetic counseling or any kind of counseling. You want to pass those informations from a patient end to the nurse practitioner or a patient end to the doctor. Everything is possible with this kind of diagnosis and treatment, then you give your opinion. So the remote device are mostly through hardware form. And we can also do with the telemedicine, the education and engagement. Repeatedly, you can do the webinar. This is now the seminars are known as webinar because it is web-based. That's why we say, and all kind of research engagement, any meetings you want to do togetherly, that is also possible, which are mostly now during COVID, we all have learned how to do web-based meeting now. And I am also doing now, speaking to you all through web-based only, okay, through Zoom link. And similarly, you can also do with that methodology. And also you can do ongoing monitoring and care coordinations. Suppose the chemotherapy has been given, then a nurse can also telephone to the patients for monitoring their side effects and toxicity and symptoms. Similarly, many things can be monitored following the treatment, and a follow-up also can be done. That is what is ongoing monitoring and care coordinations with different kinds of situations. These protocols have to be really developed in the practice. That is what is done. That requires mostly minimal hardware, like in a mobile app, and the minimal hardware investment for providers, and the complex security and data storage issues will be there. But still, many things can be monitored through a mobile app. And but the other end also that you can just distribute a telephone. So the as minimum as with a telephone, as maximum. So you might have multiple attack so that you can consult and we can do ongoing monitoring and care coordinations. Whatever our experience is that we are doing with all kinds of engagement with the telemedicines and doing both professional consultation, diagnosis and treatment, education and engagement with a schedule, timely schedule for both doctors, nurses, paramedical workers, everything, and for ongoing monitoring and care coordination. My personal experience goes with the thyroid cancer telefollow-up for ongoing monitoring and care coordinations. Either it is point to point, one patient connected to one doctor, or point to multi-point, one patient connected to multi-point, several patients connected to several different specialist doctors. Coming to the video conferencing solutions, actually what systems really you should use? These are generic video conferencing system I have written like Polycom, Radvision, Aethra, Avanya, Sony, Panasonic. There are multiple video conferencing systems are there. You can also do web-based or cloud-enabled video conferencing software, which are much more popular now, like with Cisco WebEx, Video, PeopleLink, Zoom, Polycom. Now we are doing with the Zoom Real Presence. The collaboration suites are also done mostly with the supports of hardware and desktop software and mobile apps. And there is also open source video conferencing softwares which you can utilize for video conferencing solution like Apache Open Meeting. And all these are there already. When you do the solutions and you will access this. Coming to the telemedicine software, mostly you have Televital. We have also a software which is engaged by our Ministry of Health, familiar by E-Sanjeevani, by CDAC, over the Punjab and Himachal Pradesh network. Prognosis like Maharashtra District Hospital Network, ISRO Telemedicine Network, and Mercury Nimbus is a Odisha Telemedicine Network. Integrated telemedicine software with kiosks and mobile kits are also done with the telemedicine software. Coming to the communication technology, mostly it is with a public switch telephone network called SDN. ISDN line, we always say this is ISDN line, integrated service digital network. But when you want to do telemedicine, at least you should have a 2 ISDN telephone line so that it will be better and your bandwidth has to support this. And the public internet with static IP also you can do with the satellite VSAT communication, which is done by ISRO. Mostly it is done. And you must be hearing about these different mobile communication network like bandwidth, 3G, 4G, 5G. Currently we are in 4G, mostly will migrate to 5G soon. And definitely with your bandwidth, better bandwidth, you can do augmented reality and virtual reality. All these like talking of metaverse is possible. so that you can have real life situation demonstration with the 5G network. If network has firewall, network security aspect in a device, then there is need to open audio and video port configuration at a router and firewall inward and outward traffic. Coming to the real time versus store and forward telemedicine technology. So coming to the real time telemedicine could be as simple as a telephone call, or it can be as complex as robotic surgery. This requires the presence of both parties at the same time and a communication link between them. Video conferencing equipment is one of the most common forms of technology used in synchronous telemedicine. But in store and forward telemedicine, which we used to do, and now also we used to do, store and forward telemedicine involves acquiring medical data, which I have already described, and then transmitting this data to a doctor or a medical specialist at a convenient time for assessment of life. It doesn't require the presence of both parties at the same time. A properly structured medical record, preferably in electronic form, should be a component of this kind of transfer. Coming to the telemedicine technology infrastructure categories, I think we have a telemedicine setup, Teleclinic can be done, and a portable kit also, which I will show you, and the mobile telemedicine system, and a health ATM or a kiosk also I will demonstrate and show you. This is a typical medicine setup which there from the Raebareli District Hospital network with our Sanjay Gandhi Postgraduate Institute at Lucknow. There is a video conferencing system, and you can see the large display monitor TV, X-ray scanner is there. This is a VIDAR X-ray scanner, and the digital microscope for pathology, it's there, you can see, and the computers are there, and also the printers are there. These are the minimum requirement if you want to do through hardware telemedicine setup. This is the typical setup which is done at our Lucknow center. This is an ongoing telemedicine system also with the same district hospital at Raebareli, and these are how to doctor like point-to-point telemedicine, which I have already enumerated to you. This is a large screen, and the doctor is doing from computer, and you can see that how he is monitoring. This is another picture where one of our gastroenterologists, Professor Ghosal, is just speaking to abroad, and this is how the doctor to group of doctors in point to multi-point video conferencing suits you can do. This is from the Department of Medical Genetics in the multi-party session. You can see multiple people are conversing now, and similarly we are doing with telefollow-up, and also there you can see that ongoing conference using network with Nepal and Thailand, where Professor Misa is there. You can also see doctors to group of doctors using telemedicine kiosks for patient care. You can see one of our gastrointestinal surgeons with a large display. You can see multiple people are listening to one of our professors in a large display with a desktop PC, and there is a VC and kiosk and internet node of the hospital with the public IP only. We have utilized the hospital network to demonstrate to you how the telemedicine can be done with multiple people in this scenario. Everybody is listening. See, this is doctors of the gastrosurgery department, and this is a professor from gastrosurgery, and it is consulting to all the department for education purpose to the other gastrosurgeons of the country. And this is a doctor to doctor. This is basically known as a surgical skill transfer. Like in a digital OT, we say it is a digital OT. This is the inner view of an integrated operation theater. You can see simultaneously, you can imagine the images also you can see, and whatever the OT picture you can see, you don't have to really focus always. Many residents who are assisting or anything, they can visualize at same time. So this requires a video conferencing system. Large display monitors are there, in-light camera, auxiliary camera. Now the cameras are coming which moves a 360 degree.
The doctor to doctor.
This is an inner view of an integrated operation theater. Would you able to listen someone correctly? Okay. So next, I'm moving to the digital wall for multiple sources like video conferencing, and this is a digital OT with live only. You know, these are the pictures which is seeing the live pictures when the surgery is done. That means it is real time. This is a telepresence suite for surgical skill sharing. Like the students, they may not go into the OT, they can visualize, there is a huge screen. You see the multiple points and they can sit here. They may not have to go to the OT. Simultaneously, they can log, and the surgeon who is operating, he can demonstrate them what are the nerves and the structures surrounding them, how they are going, and they can learn this. So this is basically surgical skill transfer with a telepresence suite. So the sharing of surgery, all these things can be done with the video network, and you can see the sharing of surgery at multiple locations. It is not only there in SGPGI with the telepresence suite, you can share them to multiple points. That's what is demonstrated in this slide. Coming to the E-Tumor board, currently we do almost every week, there are classes for E-Tumor board that you can see multiple departments like the radiation oncology, radiotherapy, radiodiagnosis, nuclear medicine, then the surgical specialties or medical specialties, they come together in this room. This is a room dedicated for discussion, and you can share this. First, we have our own, means the content of the patients, then we do as a case discussion. At the same time, we can connect to multiple locations all along the world. It's not that we'll across the globe, we can connect, and simultaneously you can see so many students in the morning from 8 to 9 o'clock are listening and seeing this case discussion, and everything is shared. The live robotic surgery was also transmitted from Korea. This was a conference session, and the doctors connected from different parts of the countries in real live interactive mode, as well as through mobile and desktop. Live streaming available through NMCN portal. This also has been in the National Medical College Network portal, which is a knowledge portal by Ministry of Health and Family Welfare, and it was managed by us at SGPGI. And this is what I am demonstrating in this slide, so that you can realize what really can be done for this knowledge sharing, and also for the skill sharing among the doctors, nurses, and paramedical staffs. Even the patient, you can demonstrate and discuss after this, the education, so whatever you want to do. And this is also the outreach activities. You can also help the public. This is an example from PGIMS Chandigarh with Asa Jyoti. This is a mobile van. You can connect to your hub directly to the PGIMS Chandigarh. Similarly, we have also a bus which is supported by the ministry as well as a CSR project from LDECO. And this bus goes to the villages, stay there, and from there directly this can be consulted. So through a riding over ISRO VSAT, or we tried also with WIX, you can connect them from there. So we have little laboratories for the primary care. We also are trying for the complex oncology care with these outreach activities. You can see many people in India from different hospitals also, they have different kind of bus for the eye care. Somebody is having, so different people in the south, they have also for eye care, these vans goes, and they have, that's why we say the doctors on wheel or telemedicine on wheel. These are the examples of this. Even the AIMS Cochin, the application of AIMS telemedicine van, when there is a telehealth service in flood affected area and the flood happened. That means during the disaster, you can also help with the telemedicines. You can take the help. Similarly, you can reach the unreached areas with the telemedicines like the Ladakh or the Kargil. These kind of stops can be easily reached with the telemedicine if you cannot physically, and the patient can be transferred to the ambulance. All this consultation, everything can be possible. Also, you can utilize some portable telemedicine kits to reach also to the villages, and the technical staff can go with the paramedics or nurse with the portable mobile telemedicine. First, these are different examples. Like this is a disaster telemedicine kit designed in 2002 and developed in the year 2002 in POC in Gujarat earthquake. And these are disaster site, and the telemedicine disaster management kit was utilized. Similarly, we have also developed from SGPGIMS Health for You kit, which cost around ₹1,00,000 only, nothing much. And this kit contains a BP, the temperature monitor, the respirator monitor, all these kind, and the blood sugar monitoring also is possible. So these are a telemedicine developed by many. This is a kit developed by ICM funded Arogya Sri telemedicine kit, and the kit contains almost the similar equipments there. You can take them to the villages and examine. This is a Sky Health Center, like patient care at the doorstep. This is with World Health Partners, and mostly in the Uttar Pradesh and Bihar, it has been reached. You can see this Sky Health Partner, and you can see the advertisement with their health, Sahar ki doctor ghar ke paas. So this is the kind of awareness you have to make. That's why the caption is there and the label, your advertisement is there. And how they examine it is also demonstrated in this slide. You can see also the Sky Health Centers is a mobile health center which is going. This is with World Health Partner. And the live streaming and mobile learning also simultaneously it's there from the OT. I think the surgical video at doctor's workplace at our Lucknow center in SGPGI, and this surgical video streaming on tablet and mobile phone over wireless internet. This is model for mobile e-learning actually. Like if you don't want to go, because many people are working in a different place, it may not happen that they have to go to the telepresence suite to learn that surgical skill or surgical skill transfer. So obviously this has gone to the palm top or laptop, or sometimes with the mobile phone only. Now the mobile phone with the 4G or 5G network, you can do easily the live streaming, and you can learn also from the mobile. So mostly people are now comfortable with the mobile. That's why it is there. This is Glow Heal, the telemedicine kiosk from Tata Communications. You can see how the cloud-enabled kiosk bundle with an option for a bandwidth, video conferencing system and software, everything is here. You can see this is plug and play, just like that. And by Tata Telehealth Services, this is one example of how different systems are developed in our country. And this is cloud-enabled kiosk system. And there are different health kiosks we have, like E-Health Access virtual kiosk, which was developed in 2012 in Hyderabad. And then Swark Health Kiosk, Dr. Insta in Gurgaon, Apollo Health Kiosk in Chennai, Apollo Health Kiosk in Mumbai, and Medongo Health ATM in New Delhi. So different people are developing these health kiosks so that it is easy to monitor the patients, talk with the patients anytime. Suppose a doctor is there in the OPD, he can just take that health kiosk and discuss simultaneously with the in-person care as well as also with the telemedicine care in the same sitting. That's possible with the health kiosk also. And these are the example of these health ATM, and this is Medongo Health ATM, which you have this. We have recently also started with a project called YOLO Health ATM in putting them into the smart city of Lucknow Limited with 100 health ATM in the city, so that you can just enter in your by-lane in the city to that health ATM and get your parameters, and simultaneously you can all the basic parameters like your height, weight, blood pressure monitoring, ECG, everything you can do 40 parameters. Along with point of care diagnostics, they are integrated, and these integrated vitals and also point of care diagnostic like blood sugar or anything or lipid profile that you can do. Then simultaneously you can transfer through the cloud to the hub. The hub is there in our SGPGI in the telemedicine school of telemedicine, and simultaneously the prescription will go from the hub doctor to the patients simultaneously. So it is basically to make them more accessible for the care, because people think the hospitals are mostly you need to have appointment, you need to plan here in your own by-lane. You don't have to plan. In the morning, suddenly if you have difficulty, you can access those centers if you don't have too much of emergency, mostly it will like the chronic diseases like diabetes, hypertension, or little bit. But for emergency, I must tell you very clearly that we must go to the hospital emergency rather than clinging to these health ATMs. So this is just a caption in the newspaper offering medical care at your doorstep. So I told you that the human being needs always the care at their doorstep, and definitely as the civilization improve and the aging populations goes up, just like Japan, I think your care is much more important. This is known as tele-home care. I think many wearable devices has to be developed. It is already developed, and now you have to really gear up for those wearable devices in the for tele-home care to the aging populations in our country, because we are also moving up to that civilization area. Are we ready? We thought that the National Knowledge Network portal, it is there from our country. I think there is a national optic network that is called NFN, and statewide area network. This has been designed, and this is from Ministry of Health and Family Welfare. And we thought a group of people, the professors from different colleges, they thought, and the hub was here from our National Resource Center, from SGPGI, and subsequently this knowledge network is designed, and this is from to all parts of the country. You have seen now, and this is designed in this is a block diagram of different medical colleges through wide area network or a local area network connectivity. It is mostly, and you can see that how they are connected with the teleconsultation facility with the video conferencing unit, then the personal computers, then the switch, and all these integrated device like microscopes and all these cameras, everything is there.
Requesting other members to mute yourself.
Please, there is background noise. So SGPGIMS Knowledge Network Enterprise, I think you can see our multiple departments are connected through our IP network. This is a OT cafeteria from nuclear medicine, neurology, nephrology, like that. Different departments are connected with the Teleclinic, and mobile kiosk at the ward, and mobile kiosk at doctor's duty room. I told you, it might be doctor's duty room, it might be OPD room, it might be the cafeteria also. We can connect. This is a OT operator cafeteria, and the immunology, pathology, radiotherapy, nuclear medicine. So multiple departments have been connected with the SGPGIMS Knowledge Network Enterprise. This is also possible, and the hub is at School of Telemedicine and Biomedical Informatics. I have already told you the integrated digital OT at SGPGI. This is just a picture. And the surgical telepresence suite also I have shown you. This is a picture where you can see how in the different computers all the students are sitting and they are learning in the telepresence suite. And this is a video wall. And the medical lecture theater. We have a lecture theater which it is connected to 6 places across at a simultaneously time. We can connect and we can discuss anything. We can do a seminar. We can do a research meeting. Now this is telecollaboration at a high-tech medical lecture theater. I have already enumerated you. And this is the high-tech lecture theater. I am just making a collage now, just for your understanding and remembering. I think this is our all-in School of Telemedicine and Bioinformatics. This is a high-tech lecture theater. This is an integrated operation theater. I'm just summarizing. And this is the video conferencing suite where we can see and everything discuss. And this is the broadcast quality studio camera, so that you can record all the seminar or conference or webinars, everything. And the production control unit we have, and we have an edited section also we have in the School of Telemedicine. And you can see how the data server we have in the 3rd floor of that building. You can see multiple data servers are also there. And these are hardware, and every projects of ours, like different data server are dedicated. We have also there is a data server for our hospital information system, data backup here for the recovery. It is also placed in this data server room in the 3rd floor of School of Telemedicine, and this is one of the picture which I am showing. So coming to the knowledge parking,
Sir, this is
whatever knowledge we have in the periphery, I think this, are you seeing my slides?
seeing, but this is too high for this audience, sir. Please go ahead, proceed and conclude.
Okay. So this is telemedicine network for monitoring systems. These are the data center where this is the health knowledge park. Each data server, they are for storage and again for retrieval of this data content. I have already told you there is a mobile penetrations versus desktop internet user. That's why now we are mostly focusing on the mobile network, and this is how this has been developed. Coming to the conclusion, I think these modern technology and systems which I demonstrated from hardware, mostly I demonstrated with mostly hardware and a combination of software. I think mostly now the focus has gone as we have developed with the software technology now, and the modern technology and systems using digital technology has facilitated medical diagnostic systems, in particular image intensive specialties like pathology, radiology, and dermatology and ophthalmology, nuclear medicines, and with lowering cost of digital devices, it would be possible to deploy a digital pathology system, radiology system, and also network with other medical institutions to facilitate service care delivery, exchange of knowledge, and assist in collaborative research. So this is what is the evolution of telemedicine and the practice of telemedicine in the last 2 decades in our country. I show you our experiences. I also shared you with a few experiences across India, and I think, hope you must have realized what really you can do with the telemedicine. The combination of hardware, the software, and the different approach, like you can do with the hardware technology, you can also do with just an app which you are doing completely for the now satisfaction. The similar kind of monitoring of the care can be done through app, triaging can be done through app. So many things you can do with your mobile rather than just going to the hardware technology. But nevertheless, I hope that you should have a feel of telemedicine, and I think the further lectures also will enrich you regarding this. Thank you very much for your patient listening.